Namaskar. You are watching Dr. KK Med Talks Fridays with Dr. Anita Kant, non-stop show 1038th episode. Let's have the headlines of the day. Study links low oxytocin levels to symptoms of polycystic ovary syndrome. Imbalance in gut microbiota leads to PCOS and endometriosis and affects the mental health of women. 8 out of 10 women report PCOS impact on self-esteem study. Higher suicide risk in women with PCOS, says study. Recent study revealed that drinking coffee daily linked to decreased PCOS risk. So let's go to the topic of the day. Today, we will be talking about PCOS and mental health. And our special guest who will be telling us all about this is Dr. T.S. Satyanarayan Rao. Dr. T.S. Satyanarayan Rao is a distinguished professor emeritus in psychiatry at JSS Academy of Higher Education and Research. With decades of experience in clinical psychiatry, research, and teaching, he has made significant contributions to mental health care in India. His expertise spans a wide range of psychiatric disorders with a particular focus on mood disorders, geriatric psychiatry, and psychopharmacology. Dr. Rao has published extensively in national and international journals and has been a key figure in shaping psychiatric education and practice, fostering advancements in both academic and clinical psychiatry. Welcome, Doctor. Welcome so much to our show today. So,
Thank you so much
let us
for this invitation.
welcome. So let us start talking. Today we will be talking about PCOS and mental health. So the first question that we've got these questions from viewers, and I'm putting the first question to you. What is polycystic ovary syndrome, and how does it affect mental health?
Of course. In gynecological practice, this is one of the very, very common syndrome one comes across. I'm married to a gynecologist. That way, I'm frequently referred some of these cases for handling associated problems. We are all well aware that we have a life cycle where certain changes happen, and particularly when we are talking about girls or women, well accepted concept is reproduction, menstruation, associated issues. There are different types of criteria are there, but the important issue is there are certain changes in ovarian function. People have documented certain cysts, maybe additional, more or less, maybe, and because of certain changes, whole lot of issues happen. One of the most important thing is actually, in fact, say when we are trying to talk about puberty and adolescence, there are a lot of things like maybe acne, some hair growth, or maybe eating disorders, and psychologically being little reactive, feeling sad or feeling high, and many of these type of things are common. We all attribute these are all like almost like adolescent related changes, but sometimes we need to differentiate whether it could be related to something organic, and that's where actually the gynecologist will elaborately evaluate the individual for any changes that are happening. So this is related to few of the hormonal changes which actually we see, maybe something like increased androgen like effect, and maybe because of range of things. Of course, one in the high headlines you mentioned about nowadays we are talking about eating and other related disorders, a strong association, how it is actually will look into. Plus, few of the other things are related to metabolic syndromes. This is something like maybe putting on weight and eating disorders to, in fact, mental health related issues. Each contribute to certain cluster of symptoms, which you call it as polycystic ovarian syndrome.
So, what are the common mental health issues associated with polycystic ovarian syndrome?
See, but one important point is stress is actually a common factor for so many disorders. In fact, stress means both healthy stress is there, but something which actually makes us uncomfortable, distress, and in fact, that's what I call as distress related to the stress. Once stress is there, see, you imagine a young girl developing acne or a little hair growth or putting on weight or cycles are not regular. Automatically, one is the family, friends, and her own anxiety related to each of these things. Extremely common stress, what we talk about. In adults, maybe after adolescent, this becomes one of the very important issue, mainly because issue of marriage and whole lot of other such things also come into the picture. Already married, infertility and other related issues get into the picture. So the common thread is there is increased stress. Increased stress leads to anxiety, depression, and in fact, I can quote any number of cases where, including strong suicidal and other related ideas which go along with that, uh, ultimately leading to low self-esteem and other related symptoms. In fact, each of these, whether we are talking about stress in general, mood changes, what which accompanies this particular disorder, or what we basically call the self-esteem and such other related things, they all contribute to specifically establishable syndromal pattern to common general anxiety, depression, and other related things. So,
Uh, yes,
yes,
continue.
yes, PCOS
Yes,
is
yes,
very strongly that way associated with psychological distress.
yes, yes. Sir, I remember there was a young girl, due to her religion, they don't cut hair in her religion. So she almost had a beard, and she would refuse to go to college. And she was admitted with acute depression. So the physical changes that happen, the severe acne, because of the male hormones in PCOS, or the hair growth, especially in visible areas like the facial hair, and the excess weight gain, which is really sometimes out of proportion. So, because of the peer pressure, do these girls tend to become more moody and more problematic?
Yes, yes. One of the very common things what we have observed is one is the body image. Everybody is very much concerned. See,
Yes,
one of the very common observation, particularly among girls, particularly among that puberty adolescent, is they are very much concerned about body image. Add to this cosmetic changes. These
yes.
two things they make a deadly combination, and they are seeing her own friends who are there, and even in the class, the teachers and the family, you are like this, you are like that, and a whole lot of such is. In fact, in fact, one of the characteristic term I can use here is bullying. Literally drives these girls into a whole lot of things, and extremely common. This thing is actually there's the anxiety and what we basically call depression, and because of this low self-esteem is, in fact, they withdraw themselves, don't mix with people, and don't come out. That adds further to the increasing weight, eating, and such other related problems. But basically, what we have seen, majority of the people in this particular age group avoid eating because we'll put on weight like that. You imagine, actually, she is putting on weight for a range of reasons other than actually food itself. They will not be able to understand why this is actually happening, why this is happening to me alone, why actually, in fact, I should suffer in this particular fashion, why I should be the butt of ridicule from others. So these are all very common in this particular age group. And my anxiety is related to married people. See, in many of the families, particularly, many people believe that in the movies and all, they have seen that boy and girl go out for a walk, and next day she is already vomiting. And in certain families, immediately after marriage, the whole concern is actually conceiving. This infertility issue is something very, very common. I actually particularly deal with psychosexual issues, and not getting pregnant is one of the most common problem, and for which again we have to very often refer them to the gynecologist and get the help done. So when we are talking about that particular age group, bullying, that particular term is very characteristically explains things.
Yes, I agree. So there are a lot of hormonal imbalances in polycystic ovaries, like,
Hmm.
estrogen is in excess, and like I said, androgen is also in excess. So do these hormonal imbalances also play a role in mental health issues?
Absolutely. In fact, one of the very characteristic this thing is, see, one is you have mentioned about hyperandrogenic state and maybe estrogen to some extent. But when somebody is put under stress, automatically it triggers a whole lot of what we call as say hypothalamo adrenal axis we call. That means what is happening in the brain, what is happening in that whole axis up to that means each and every system is involved in our body. So there are three important, maybe you call it as neurotransmitters or hormones, which actually create difficulties. One is this cortisol. See, ultimately, whether we are talking about androgens or estrogens, they have been shown to have a significant impact on what we call as the cortisol production. Whether cortisol excess is actually responsible or it is only effect what we are seeing may be a little difficult to answer at this particular juncture. But all said and done, all the things what we are talking about, either we are talking about appetite, mood changes, self-esteem to other related things, this cortisol is one of the extremely important problem. The second one is actually the adrenaline, norepinephrine. See, these are all sympathetic system related. That means automatically they increase anxiety and a whole lot of related syndromes. And another neurotransmitter which gets affected is actually serotonin. There is a relative balance. Something increase here means automatically there is a decrease in serotonin. Serotonin is one of the very responsible cause for what we call depression. As a psychiatrist, let me just elaborate another one small point there. See, when we say in the environment there is some particular problem is there, which is triggering anxiety and depression in me. Say, take an example, classic, failed in the exam, maybe loss in the business, or maybe a divorce, or this one, that each of these type of things actually create quite a bit of difficulties. So this is what you call as situation related or actually the reactive form of depressions and things like that. But lot of changes that happen endogenously. In fact, this is what you call as endogenous depression. This is because of that hypothalamo adrenal axis involvement, and this produces whole range of changes. Let me tell you very briefly. There are a few criteria which have been very clearly established in international classifications. One is appetite changes, weight changes, the bowel and bladder related symptomatology, menstrual related problems, strong suicidal ideas, diurnal variation, wherein symptoms are more in the morning hours. So these are all very classically established changes. And libido, significant decrement in sexual interest and arousal. More particularly, this is a common terminology we use as far as the females concerned nowadays in classification. So all of these type of things are attributed to one is this is one. You add to this, there is a testosterone. See, testosterone is a hormone again. See, in case of a boy, issues are different. In case of a girl, issues actually a little different. What is not
Yes,
necessary, it is here means it creates difficulties.
definitely, definitely. So, is there any link between PCOS and panic attacks also? So,
See,
how to manage this anxiety?
anxiety. See, for example, anxiety is I'm not sure about what is happening, and see, for example, exam is an anxiety generating situation because
Yes.
whether I'm going to pass or I'm going to fail, I don't know. See, if I tell everybody is going to fail, there is no anxiety.
Mm.
If I tell everybody is going to pass, there is no anxiety. Whether I will come first or last, that means where uncertainty is there. So anxiety has psychological symptoms. It has autonomic and other physiological symptomatology. Panic is nothing but very acute anxiety presenting in far excessive fashion. See, because of which each and every system is functioning at a very high level. What it means is, say, for example, take an example, heart. It is beating very fast, and it may be skipping one or two beats. And many of those type of symptomatology, person will feel actually terribly little this thing. He may get that floating sensation. Maybe if I feel I'll collapse, and a whole lot of gut feelings, and feel like running to the toilet, and a whole lot of other such things happen. What it means in general is actually anxiety in a bigger fashion in a very short time if somebody experiences what we call it as panic. All anxiety disorders are associated with panic also. But if panic symptomatology becomes a very dominant picture, now we call it them as a panic disorder itself, in the sense that this is one of the things which is presenting it in a very significant fashion. What it means is, again, from the treatment point of view, certain types of drugs what we give in a generalized anxiety disorder is a little different from in panic disorder, where we need to control the symptomatology very fast.
So, like you mentioned, these individuals who have PCOS, they have infertility issues also. So, naturally, here the bullying is from the relatives and
Hmm.
the elders in the house. It may be their own parents or their in-laws who would want to conceive early, we want a
Hmm.
grandchild or whatever. So, how can they cope with this emotional stress which is due to their PCOS?
It's a, one of the most first what we actually advise them is forget about getting pregnant. See, all the time you are thinking about getting pregnant. See, I have come across ladies with every onset of menstrual cycle, they become so panicky and so disturbed because again the whole cycle has to be repeated, and so many explanations have to be given to the family members. So when we are talking about management of this one, first non-pharmacological and behavioral techniques we have to follow is actually helping them understand the whole issue involved. Second one, range of relaxation techniques are there. Whether somebody talks about yoga or Jacobson's progressive relaxation technique or many other such other things. Other behavioral techniques like positive viewing and future and other related aspects. How actually this is one of the problem at this particular juncture, which can be improved. So there are some issues are there, problems are there. That means first take the individual that anxiety out of this particular pregnancy. Many of them actually once they become engaged with certain other activities, they become pregnant. More they actually feel should become pregnant, they will not be becoming pregnant at all, mainly because that itself acts as one of the major stress factor which interferes with ovulation and a whole lot of problems. That is one. Bringing the relatives and involving the family is extremely important. In many of the cases, parents, maybe in-laws, husband, other relatives, they do come, and when we do this family counseling and all of that, we have found a very positive and good response in many of them actually. But in certain, maybe in certain communities, in certain families, where getting the baby immediately is actually one of the whole important issue, that becomes one of the major common problem. And you add to this another this thing, oh, she has taken some psychiatric treatment, some psychiatric help and all, means in fact that becomes one of the major stigma factor actually, some of them. I believe she has taken treatment earlier with you. They don't even understand that this is common problem and this is extremely understandable situation, but some of them may not really understand this. That means whole issue here is actually whether we have to use marital therapy when we are talking about husband and wife, or family therapy when other relatives are involved. Individual therapy to the individual to make her understand. In fact, educating her itself takes care of 50% of the problem. That's what I can say.
Yes, I agree about this because everybody is going through stress, not only PCOS patients,
Yes, yes,
everybody is
yes.
going through stress.
So
Exactly.
involving the family is extremely important.
Mhm.
In fact, very recently, they were almost talking in terms of divers. They are from this particular place, and this particular girl, of course, we had treated her for some epileptic type of this thing long back, more than 14, 15 years ago. She has not conceived. That's all the whole issue. But when we got the husband, he was a quite understanding fellow, and now she has conceived and already now about 2 months or so. What I am trying
Okay.
to tell, yeah, all the families are not bad. The
Yes.
whole issue is involving them and make them understand the issue. Many of the things can be settled. Only thing is we have
Certainly.
to make that particular effort to get the family members, talk to them, and explain to them what is actually the situation. More pressure you put, more difficult it will become. Actually, in fact, that makes wonders.
Yes, I agree about that. And sometimes in PCOS, they tend to eat more. Emotionally, they're upset, and emotional eating is there excessive. So,
Yes,
can that also be taken care of by
absolutely,
some
absolutely. In this,
strategies?
particularly in young ladies and middle age, see, one of the classic examples sometimes while teaching students, we give this example. Say, when you fought with your husband, do you eat? They don't. Once he goes out, they'll empty the fridge completely. You got the point. So, psychologically,
Okay.
eating itself is one of the what we basically call relaxing activity for many ladies. There are two ways actually this can be explained. One is people don't eat, but many of the times, particularly PCOS, when we are trying to talk about this binging. In fact, this particular terminology, what we call as binge eating disorder. In recent DSM classification, there is a special category for this itself. Or binging itself, what we call as just like anorexia nervosa, there is something called as bulimia nervosa. In bulimia nervosa, what happens is actually it is one of the established syndrome wherein individual eats at certain occasions excessively for a certain length of time, feels guilty about it, then either purgates or vomits or does a lot of things and tries to avoid food. This is one aspect of it. In binge eating disorder, this anorexic type of symptoms may not be there. But there are certain occasions when put under stress, eating is one of the very important way actually they try to overcome their anxiety or stress. So I am trying to differentiate two things. One is actually bulimia nervosa, where this is the other phase of this anorexia nervosa. For example, there may be a lady. These are all actually what we call as body image disorders.
Mhm.
Somebody almost might have become skin and bones, but all said and done, she still believes that she is actually overweight. They try to avoid
Yes.
food. So
Yes.
they actually a whole lot of pathological processes that happen there. Bulimia is another wherein actually, say for example, they're avoiding food for pretty length of time, and then at one particular day, maybe one particular week, she will eat so much that automatically all the advantages what she received earlier it will be lost actually in that particular time. Then they feel
Yes.
guilty and whole lot of processes they try to induce. So it is a classical syndrome where anorexia, bulimia, eating, both of the things will go. Binge eating, it is eating alone to overcome the stress. Very classically this is. And automatically we are all well aware, we have this gut neurohormones are there. Ultimately, eating is related to, as far as the brain function, two things. One is there has to be something to control our appetite. Otherwise, we keep eating.
Yes. I
Other thing
agree.
is actually what we basically call to induce appetite. There are certain things necessary. So in our body, there is a whole balance. This is going on actually. After I eat something, and I'll not eat beyond that for various reasons, maybe. But this particular control mechanism, that balancing mechanism, is gone in certain individuals because of certain hormonal changes. And this has been attributed to again presence of testosterone, to cortisol, to a lot many other hormones.
Hormones.
It is almost difficult to pinpoint. This is alone which is producing all this difficulty. Something biological, something. Sometime back, I was reading about an article, epigenetic phenomenon, in the sense
Yes.
that it is there from the beginning itself. There are some people prone for this,
Mhm. Yes. I agree.
so they try to imply that.
So, how does lack of sleep due to PCOS symptoms affect the mental health?
See, PCOS symptoms, lack of sleep, any depression disorder, sleep depression is one of the common this. You talk about any anxiety disorder, sleep disturbance is common. When anxiety alone is present, there may be difficulty in getting sleep. When we say depression, We told you that reactive, that means something situational, environmental related. Individual feels a little tired and all of that, but may find excessive sleep and all of that. But in case of endogenous depression, what happens is early morning awakening. See, if somebody was getting up usually at say 7 o'clock, now getting up at 6, getting up at 5, getting up at 4. 4 o'clock is actually one of the very classically used terminology here, because as and as earlier the awakening, it indicates the presence of depression and anxiety. The two major depressive disorder. Almost like what we call one variable which can be highly diagnostic of endogenous depression is actually this early morning awakening. If somebody says that this is actually the symptomatology, then I'm very anxious in the whole of the morning and I feel better only at 10 o'clock, 11 o'clock, 2 o'clock, 4 o'clock in the evening. This indicates that this particular individual is suffering from another major depressive disorder. So it should be treated. That is one aspect of it. Second one, see, the whole range of hormones are involved in this process, actually, what we are trying to talk about. So that also leads to production of certain chemicals in the body which can create difficulties. There is another problem. If those who are putting on weight, obesity with what we call as respiratory syndromes are there. That anoxia acts as an appetite triggering agent, and people keep eating, and one of the well established clinical syndrome linked to that way. So PCOS, some of the respiratory disorders, and what we basically call obesity, they have a very strong relationship to each of these type of things. And sleep disturbance automatically affects a whole range of what we basically call metabolic processes, and this is one of the reasons why metabolic syndromes are extremely common among these individuals. The insulin, which is supposed to act properly here, won't act. The insulin resistance, what we talk about,
Yes,
to
yes.
other metabolic syndromes, are extremely common among these individuals.
So, this if the emotional instability persists even after starting the PCOS treatment, should therapy be, psychological or psychiatric therapy should be considered alongside the medical treatment?
It should be considered. This is one of the very important. See, many of the times I have seen some of the gynecologists writing that B12 supplementation or D3 supplementation or vitamins in general, or many of them actually they will be doing a little bit of counseling also. Don't worry to how actually this is a problem can be handled. But there are some cases where a professional help may be necessary.
Yes.
This is where actually we have to keep it in mind. Say, for example, say somebody is talking about significant depression, depressive ideas present. When we talk about depressive ideas, it means ideas of hopelessness, ideas of worthlessness, suicidal ideas. These are the things. And there is another depressive triad we call. Depressive triad means feeling negative about self, feeling negative about the world, feeling negative about the future. See, this is one of the major triggering factor for development of what we basically call suicidal and such as a related ideas. Say when we are trying to talk about, for example, September 15th, we are International Day for Suicide Prevention. We talk about. So when you are talking about suicide prevention, depression alone, comorbidities are extremely commonly well documented phenomenon, and where professional help necessary, that should be provided. Many of the time
Right.
counselors with certain psychological therapies they can do, but sometimes even role of antidepressants to other pharmacological treatments are also necessary. That should be done.
So I think in the end, I would like to say that we talk about lifestyle changes in PCOS,
Very
but
right.
getting mental health treatment is part should be part of that lifestyle changes. Right. Thank you
Absolutely.
so much. Thank you, Dr. T.S. Satyanarayan Rao, for joining us today. Could you
Thank
please
you.
show us the certificate, please? This is a small thank you from our side for
Thank you so
coming
much.
here today and telling our viewers so much about PCOS and mental health issues. That will be all for today. Dr. KK Med Talks will return tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK Med Talks. Namaskar.
Namaste.